Hello everyone, Dr. Suneel Dhand, internal medicine physician. Welcome to another video. I'd like to think those of you who follow me here do so because you want open, honest debate. You want to hear a diverse range of opinions. You want to come to your own conclusions. You don't want things shoved in your face. And you want to hear stories that are not being widely reported in our totally corrupted mainstream media. Now, I'm going to share with you a story that was reported in some segments of our media only over the last few days. And last week, I made a video about a rather shocking statement that was made by someone at the top of the FDA, but we have now bettered that within the last few days because the FDA commissioner himself said this. So here we have an article published on CNBC, their website. Health misinformation is lowering US life expectancy, FDA Commissioner Robert Califf says. Life expectancy in the US is a huge topic of debate, but I wasn't expecting that one. That came out of left field, as they say. What the heck is Robert Califf talking about? In an interview with CNBC, Dr. Robert Califf said better regulation is needed to combat health misinformation that's rampant online. I'm sure he thinks that that's the case. I'm sure he wants to censor anyone who disagrees with him. That's what they all want. He also said the agency, though it has no direct role in drug pricing, will use its bully pulpit more. New obesity drugs bring great hope, Califf said, but need more data. Life expectancy in the US is between 3 and 5 years lower than the average in other high-income countries, and the gap comes in part from misinformation, FDA Commissioner Dr. Robert Califf said. It's looking worse, not better, over the last several years. Califf told CNBC in an interview Thursday at the agency's headquarters in Maryland. Let me share with you this graph that highlights those worrying numbers about life expectancy in the United States. Here we have it in that article, and I'm going to share the link with you down below to the article. Life expectancy in the United States and other comparable nations. Look at that. How concerning is that? The United States line is well under other wealthy countries, including Australia, Austria, Belgium, Canada, France, Germany, Japan, Netherlands, Sweden, Switzerland, and the UK. Quite a big difference there. So let's dive in a bit more to what Robert Califf is saying. It's not just the pandemic contributing to the decline, he said, pointing out the gap with peer nations is widening. Califf said a new factor has joined the list of known causes of life expectancy disparities like race, ethnicity, income, and education. Living in a rural area where he noted that people are exposed to different information sources. Well, of course, like all people at the top of US authorities, he wants to be in control of the information. He's the sole source of truth. Why aren't we using medical products as effectively and efficiently as our peer countries? A lot of it has to do with choices that people make because of the things that influenced their thinking, Califf said. What an arrogant statement to make. He talks about a bigger bully pulpit and then incentives for research and then new obesity drugs, which he seems to be very excited about. So did you all hear that there? Robert Califf, FDA Commissioner, believes that one of the main reasons for these striking differences, very worrying differences in life expectancy is the fact that people are falling victim to misinformation. They're not listening to enough information from authorities and they're not taking enough medical products and drugs. Can you believe that? And for those viewers who are not in the United States, this person, Robert Califf, is one of the top public health officials in the country, and he is so razor focused on this issue of misinformation. I wonder why. Now, if Robert Califf had any sense of what's really going on in America, he may realize that one of the main reasons for this horrible discrepancy, well, first and foremost, of course, the United States is a country which unfortunately doesn't even give its citizens basic healthcare. We have a private insurance-based system and people pay for healthcare. First and foremost, that's obviously a factor, and he doesn't talk about that. And then, as far as I am concerned, and obviously this is my specialty, I believe that the number one reason for this discrepancy is that America has a horrible, toxic, pro-inflammatory food culture, primarily ultra-processed foods. Millions and millions of people are consuming ultra-processed foods every day. The official statistic now is that 70% of all calorie intake is from this junk rubbish. People are consuming it every single day, and most people out there don't realize the damage that this is going to do to them in the long term because they are consuming foods that their bodies are simply not built for. The whole system is set up with food corporations to make deliberately addictive, hyperpalatable food. And we are seeing the results of this in the statistics. Soaring, unprecedented rates of obesity, type 2 diabetes, heart disease, other inflammatory diseases, all occurring primarily because Americans are eating the wrong food. But what is the FDA commissioner focused on? What does he never mention at all? And remember, this is something that disproportionately affects poorer people as well. The fact that we have a horrible food system that sets people up for illness. But of course, if they are set up for illness, then they are going to take the drugs that he is advocating for, because we have that type of mentality at the top. Now, of course, there are other issues involved as well in life expectancy differences, such as the mental health crisis, the fact that we have a mainstream culture that encourages all of the wrong things, turns people towards drugs and other bad behaviors, etc. There are a lot of things playing into this, but I can tell you that misinformation is not one of the top reasons. Robert Califf is way off the mark. And what chance does America have when we have people like this at the top? What clownery, what utter buffoonery for him to make that statement and not say what the bloody obvious factor is in why America is doing so badly compared to other countries. According to Robert Califf, our problem is misinformation. It's that Americans are not taking enough of the medical products and drugs out there. That is the solution, according to one of the top officials. This is why in the United States we need a complete revamp of the system. We need to start from scratch, and we need to get rid of everyone who is in a top position right now, because they are not focused on true health and well-being. If they were, the very first thing they would want to do is try to advocate for policies to get real food to people, to make that the default and cheapest choice, to simply eat what our grandparents and great-grandparents used to eat, so that our bodies are not sent into a metabolic tailspin that sets us up for disease and a reduced lifespan. And the United States really needs to turn this around very fast. I hope we can do it, because Americans deserve better than these buffoons who lead us. That's all I've got to say about that. Thank you everyone for listening. Dr. Suneel Dhand. Do let me know your thoughts down below. Check out my online course and my Uncensored platform. Those links are down below. Remember, huge swathes of healthcare and medicine are completely and utterly corrupted. And one of the best things you can do for your health is to empower yourself. Be as educated as possible so that you and your family can have the optimum level of health and well-being. And stay away from the medical system. Stay away from doctors unless you absolutely need them. And that starts with what you eat. Minimize those horrible ultra-processed foods. Eat real foods. There are plenty of great foods out there. Minimize sugars, minimize seed oils, minimize other artificial ingredients. Refined carbohydrates, etc. should also be minimized. The closer you get to natural eating, the better, and you will have much better physical and mental health all around. I hope you can do it. I hope we can all do it. Beat the system that is trying to make us sick all the time. Thanks everyone again for listening. Hit the like button if you like this video and the bell button for more similar videos in the future. And we will talk again very soon.